Good evening and welcome to the special broadcast right here on NDTV. So, a good announcement has been made by the government where more and more vaccines are now being considered for use. Some have been given emergency use authorization. This coming in the backdrop of what was being discussed extensively, a possible vaccine shortage. As India tries to overcome this challenge, the problem has been compounded with the ever-increasing COVID cases. We are approaching close to 2 lakh cases a day. At a time like this, our already strained health systems will be strained further. And amid all of this, how should be the movement of this country be as far as improving our economy is concerned? We were just about recovering from the process of the lockdown and also the slowdown. And now comes a second wave, and also a vaccine shortage and a bed shortage and all the problems that are associated with COVID-19. So COVID-19, the vaccines, as well as the future of our economy. Let's discuss that. I have with me an eminent panel. Mr. Uday Shankar, President of FICCI, is with us. Thank you very much, Mr. Shankar, for joining us. Dr. Sangeeta Reddy, immediate past President of FICCI, is also with us. And Ms. Naina Lal Kidwai, past President of FICCI, is also with us. Thank you very much. This is an important discussion. Mr. Uday Shankar, we'll begin with you first. I was just going through a letter that you have written to the Health Minister, Dr. Harshvardhan, where you talk about 2 things. Number 1, ramping up COVID testing. And number 2, opening up vaccines for this critical age group of 18 to 45. First of all, if you could just elaborate on why you made this appeal and what's the rationale behind it.
So, thank you, Sanket. Thanks for taking up this subject. To answer your question, 2 things very quickly. First of all, the reason we spoke about ramping up the testing is because we genuinely believe that the upsurge that we are seeing is because in a number of cases, in a number of states and municipal areas, we dropped the ball as far as vigilance is concerned. And by vigilance, I mean testing, isolation, and treating people who are COVID positive. And that is the need of the hour. And that is why we felt that if we really want to get ahead of this crisis once again, then the only way to do that is to really ramp up testing. And you have to understand that when the first lockdown happened, it was essential, unavoidable, because we were not prepared for it. We didn't have the testing infrastructure. We didn't even have the basic, capacity of basic stuff. Today, we are ready for it. The testing infrastructure has been expanded. There is a vaccine that's being given. And hospitals were readied for dealing with the crisis. Now, what happened is that things got better because of the harsh and tough measures we took last time. And I have to say that everybody sort of went a bit slack. And that is what we need to fight. We need to really, really aggressively ramp up testing. And that's the point that we wanted to make to the Health Minister and to Government of India. But the problem is not at the Government of India level. If this has to happen, it has to happen at state level. The other thing that we said was that the base for target population eligible for vaccination should be expanded and should include all the people above the age of 18. And that was purely for 2 reasons. One, this is the population that's most mobile. And this is the population that needs to be mobile if the economic recovery has to continue. Because people in the age groups of 18 to 45 or 18 to 50 are the mainstay of our productive workforce. We cannot afford to keep them at home, especially when we have ways of making them safe and getting them out, and so that they can earn their livelihood and they can contribute to the economic process. And that's why we said this. And to that extent, I must welcome the decision of the government, the decision of the authorities to approve the Sputnik vaccine, and also the decision today to allow some of the foreign-made vaccines to come into India. I think these are measures that will significantly ramp up our access to vaccine. The need is for all vaccine capacities to go up dramatically.
But Mr. Shankar, do you think that we wasted precious time? We could have ramped up this capacity as we introduced the earlier 2 vaccines. I mean, there is a whole controversy around Covishield not being able to manufacture enough doses. Exports have been stopped. all sorts of things. I don't want to go too much into the past, but do you think that precious time was wasted and all these concerns could have been met?
Look, there are two things, exactly to your point. Let's not go too far back in the past, number one. Number two, let's also recognize the fact that we have already distributed a large number of vaccines. Broadly, we have distributed the same number of vaccines that countries like the United States have done. It's just that the scale of challenge in this country is dramatically bigger. And that is why we need to ramp up the capacity. No matter when you started manufacturing the vaccine and how many you did, on day one, in month one, month two, there would never be a situation where you would have enough vaccine. I think the problem is not just that we didn't have enough vaccine so far. The vaccine capacity needs to be ramped up every day. That's what we are saying. The problem was that we also dropped the guard in COVID safety measures, like testing, etc. And I have, my other colleagues here, Sangeeta, who's probably the best person to talk about it. But that's the whole issue. It was a bit of a double whammy. We got a bit complacent, we have to admit.
Okay, Dr. Reddy, let me come to you. We'll talk about both these aspects because the Prime Minister mentioned both these aspects in his address. He said that while we do concentrate on vaccines, we must also not forget the focus on testing. Do you feel that collectively, I mean, right now you have a situation where testing is a huge problem because of this sudden surge and burden. In some states, testing is taking up to 2, 3, 4 days. Do you think this is a huge problem that we are facing right now?
So clearly, Sanket, we're in a multitude of problems or in a complex situation. And therefore, what FICCI is recommending is a multifaceted, multidimensional approach to the problem, which is number one, step up awareness and go back to all the safety measures, wear masks, social distancing, sanitize. This is where the complacency that Uday was talking about had set in. The second thing that we spoke about is testing, and why testing is critical is that you get to know someone is positive, you're able to isolate them so that you don't have an infected person moving around and infecting multiple others. And as we all know, we have multiple variants coming out. Some of the variants seem to have a higher virality than others, and therefore it's critical to keep testing. And why testing is an important aspect is that we have opened up the economy, and rightly so. We need activity, we need movement, but if we can be safe while we're doing that, we would have created the right kind of formula which is required for the next 3 to 4 months, which is the time period required to finish the vaccination of the critical mass. And then coming to vaccination of the critical mass, the reason that we're proactively recommended to the government, and we're thankful that the government has taken up many of these recommendations, is that we need greater capacity. We've already vaccinated at least first dose over 10 crore people. If you look at the numbers we require at the rate which is going on now, approximately 30 lakh per day, we clearly need more doses. And with the 2 crore doses which the government has in hand, there's a need to ramp up the runway. And therefore, the 2 measures that you're hearing are very welcome. I'd also like to kind of draw attention to the fact that progressively we're seeing positive steps. So we went from 60 to 45. We went from 45 to now saying we can vaccinate in work sites. Now you've opened up for more vaccines. So every day, everybody is jointly working on this problem. So we need to keep the mood calm, proactive, and continue to work together. So that's really what we're talking about, and testing is critical in this. So I would reiterate only one last point on testing, and that is that the current capping of prices and the variations in prices, there is no incentive for many of these private labs to run a night shift. Many are reporting backlogs of 3,000, 4,000 tests. So to ramp up the requirement, a reasonable amount of a rate or a remuneration is required.
No, for testing
so
or for vaccines?
Many are doing it.
You mean for testing?
No, I'm talking about testing. So vaccination, the rate has been declared. That is a different
But Dr. Reddy, you feel 900 rupees is not reasonable?
So it is 500 rupees in some states, Sanket.
But you know, Dr. Reddy, pardon me, I just wanted to ask you, if you want more people to come into the ambit of testing, the only way you can do that is by making this testing more affordable. And if we look at some sort of a, rationalizing of this rate so that labs find it comfortable to be able to run their operations, then you will have a large mass which will not feel welcome going into a testing center because it will be very expensive. I mean, conventional Indian wisdom, if one family has to get tested right now, and if it is a family of 4, you can just multiply 900 4 times, and that's immediately a burden on a middle class family. And this figure was 4,500 last year.
No, I totally agree with you. But we're really in a conundrum, and therefore what we need to see is a combination of speedy vaccination. So some corporates are taking up vaccination and paying for their employees, and governments are offering it. Of the 1,200 labs which are approximately available right now, a significant number of them, and I must commend the government institutions, even in small district headquarters, you have labs which are testing, and all those are being done free. Sure. So free testing is available. Let us not, in the name of reaching out to the population, create these kind of delays, because the delay is far more expensive.
Okay.
In that time period of 2 or 3 days, which is taking now to get reports, these people are going out and potentially infecting a lot more people.
Correct.
So we have to find the right balance. There is no easy answer. Let's look at it with multitude of measures.
Absolutely. Ms. Kidwai, I want to come to you now. See, the point that is being made about vaccines. We have only now, I mean, there is criticism of the government that was this a knee-jerk reaction, was this a response? The point is, whatever it may be, announcement for new vaccines has been made. In that context, is a positive step. But the fact that this announcement has been made now means that for the vaccines to actually be rolled out, it will take about 2 to 3 months. Which in effect means that again for the next 2 to 3 or 4 months, you will not have this vaccination drive extending it to this large mass of 18 to 45 age group, which is the key driver for the economy. Do you look at this as a cause of worry?
Sanket, it is a cause of worry when we have COVID riding the way it is, and vaccines, as I understand, is one of the 5 ways to tackle it. There are 4 others, which I think both Uday and Sangeeta have touched on, which is to do with how we as individuals and citizens work in this environment. So on the vaccine question itself, yes, the sooner we can ramp this up, the better. I'm all in favor of, a 2-step process, one which the government has managed well in terms of price control and wide distribution to ensure that we can cover a large swath of India. But on the other, by opening it up for a free market for at least some of the vaccines, for those that are prepared to pay and to just enable that free market to operate at a different level might well be the answer. I think the issue was not just availability of vaccines. It's also about administering of the vaccine and storage and ensuring that the vaccine that is administered properly and correctly. And let's not forget that we do need more health workers. We need storage facilities. We need to make sure that vaccines are not wasted, because for every vial that's opened, you need to make sure that all of it gets utilized. So there are many aspects to the logistics of this, rather than just looking at the vaccine generation itself. But there's no doubt that we need more vaccines. We need more able people to deliver the vaccines. And I'm really glad to see corporate India come forward and take on the responsibility to vaccinate their workers. Let corporate India pay as they see fit. Let corporate India vaccinate its over 18-year-olds, because whole swaths of corporate India in the tech sector, which is such a driver of India's growth, are under the age of 45. Why should we be forgetting about vaccinating these who may well become the super spreaders of tomorrow?
I think that's a very important point. Mr. Shankar, you wrote this letter. Do you have any time frame in mind now that we are introducing more vaccines? Any time frame by which India should complete this process? Because, we asked this question of the health minister also, that why haven't you opened up the vaccination process? And he gave a response which I found convincing. He says that these vaccines are still they've been certified for emergency use, right? It's not a normal process that has been followed for vaccination. When you open it for all and sundry, and if you don't have logistics and systems properly in place and checked, then you never know what is going to happen, who will get this vaccine, what is the response going to be, and that is why it's very important to follow this drill. This was their explanation for the time that they've taken. Do you think that this explanation makes sense?
Look, I think it's a reasonable explanation. First of all, he's the minister. He has access to all the data, and he's himself a doctor. He understands how to do these things. Two, you have to also understand. So I won't want to go into that, but you must appreciate that it's a time of crisis. When the vaccine came, that was the most awaited thing in our memory. Everybody was waiting for a vaccine. And if we did not put very strict protocols and enforce them very strongly, there would be chaos. There would be simply unmanageable chaos. First, the frontline workers and healthcare workers and most vulnerable segments of society had to be given the vaccine. And I think that was absolutely the right thing. The ground rules had to be set. People had to be given a message that not everybody can get it on day one. Otherwise, there would be, as I said, chaos. But now, as we are ramping up the production of the vaccine, we believe that there are only two things that need to be done. One, we keep ramping up the access to vaccine by increasing the production capacity and by bringing in more and more vaccine. And as we ramp up production, we ramp up distribution and we widen the scope of people. And what we are, in the first phase, we never said that, the age group of 18 to 45 should also be included, simply because that was not realistic and that was not the topmost priority. Now, we have to figure out a way to strike a balance between continued economic recovery and life and safety of people. We cannot just look at one or the other. And that is why, again, we would like to make this point as part of FICCI, that it's important, and especially so for state governments, to not rush into a lockdown and not rush into closure of things. These answers do not lie there. The answers are in vaccination, and the answers are in screening, containment, and treatment. And we are ready for that. We have had the experience of dealing with all these challenges for last more than 1 year. So we should not rush into knee-jerk
reaction. But then,
reaction.
Mr. Uday Shankar, if you look at the problems being faced in, say, a state like Maharashtra, even in Madhya Pradesh, Lucknow, the state capital of Uttar Pradesh, the problem is now. And that's why it seems that there is this repeated urge among state governments to inquire about the possibility of a lockdown. See, vaccines will take its time coming. For this age group to be vaccinated, it will take 3, 4, 5 months. It will need to be like a year-long exercise. But the crisis is now.
Sanket, if I can, as both my colleagues said, I would like to reiterate the point that vaccination is not the only way you will be able to contain. Look, we have a population of 135 crore people. No matter how many vaccines we have, no matter what we deploy, we will still not be able to vaccinate everybody for next several months.
Sure.
Nor is there a need to vaccinate everybody, scientifically, I'm told. So, but there are other ways in which you have to break the chain of the spread of the infection. And so there are multiple things, as we keep saying, testing, isolation, treatment, etc. All non-essential gatherings, including a small birthday party, must not be allowed to be held right now. We are not ready for that. And each of them is a risk, whether it is a big gathering or it's a small gathering. Well, all non-essential travel should be discouraged, and there are ways of doing this. And of course, there is the whole thing of communicating, educating, and making sure that people, people's behavior and expectations both are managed.
Sure. Okay. Dr. Reddy, my final question to you. Do you feel that going forward, the government must not fix the price for these vaccines also? I mean, do it for all, by all means, in government hospitals. But surely, corporate India would be, I think, more than willing to pay, or its employees will be more than willing to pay for the exact cost or the right cost of these vaccines, and then be available to work.
So, Sanket, let me, slightly redefine the thing. Fix the price. India has long been under the drug control regulation, and therefore I think fix the price is an appropriate thing to do. Should we have differential pricing? That is something which can seriously be debated, and I think the vaccine manufacturers have clearly said, please enable us. And what they are saying is that let there be a percentage of our vaccines which can be purchased by corporates at a higher price. So I continue to say that we must have a price fixation, but can we do a differential pricing is definitely a strategy to enable the vaccine manufacturers to have an incentive. I just want to very quickly add one more point, which I'm sure many of your viewers may be asking this question. is that if you're in between your vaccination, you've taken your first shot, and then you contract COVID, many people are in a quandary, should they go ahead and take their second shot? I want to very clearly reiterate that all scientists have said that despite having seropositivity, the vaccine boosts all immunity. And therefore, you should maintain your vaccination schedule.
Correct.
Unless you're having multiple symptoms.
Okay.
So therefore, please check with your doctors. And if you're asymptomatic, you can continue your vaccination schedule or do so immediately after the 15 days of infective period.
So,
it's an important thing to keep up the schedule even if they become positive.
Okay, so broad stroke solutions like a lockdown may not necessarily be a good news for the economy. That's the message coming in from FICCI. Thank you very much, Ms. Naina Lal Kidwai, Dr. Reddy, as well as Mr. Uday Shankar for joining us on this discussion.